What do sensitivity and specificity mean for colon cancer blood tests? Imagine trying to catch every possible case of colon cancer with a simple blood test. That's where sensitivity and specificity come into play. These are key measures that tell us how good a test is at detecting disease and avoiding false alarms. Sensitivity refers to the test's ability to correctly identify people who actually have colon cancer. If a test has high sensitivity, it will catch most true cases and miss fewer people who are sick. For example, the Shield blood test for colorectal cancer has about 83% sensitivity, meaning it correctly detects 83% of people with cancer. But sensitivity can be lower when it comes to precancerous conditions like advanced adenomas, which are early growths that can turn into cancer. The Shield test detects only about 13% of these precancerous lesions, so it's not perfect for catching early warning signs. On the other hand, specificity measures how well the test correctly identifies people who do not have the disease. A highly specific test produces few false positives, meaning it rarely indicates cancer when there isn't any. The Shield test has about 90% specificity, so 90% of people without cancer or advanced polyps get a negative result. Some other blood tests, like the Galleri multi-cancer blood test, report even higher specificity at 99.5%, which means fewer false alarms and unnecessary follow-up procedures. In practical terms, having a test with high sensitivity helps catch as many true cancer cases early, which can save lives. Meanwhile, high specificity reduces unnecessary worry, invasive follow-up tests like colonoscopies, and healthcare costs caused by false positives. Blood tests for colon cancer screening, such as the Shield test, are less invasive and may encourage more people to get screened, especially those who are hesitant about colonoscopies. However, these blood tests have limitations, especially in detecting precancerous growths, which colonoscopy can remove before they turn into cancer. That's why a positive blood test usually needs to be confirmed with a colonoscopy, which provides a definitive diagnosis and allows for staging if cancer is found. Negative blood tests do not guarantee you are cancer-free, so screening and follow-up should always be tailored to individual risk factors and medical advice. Understanding sensitivity and specificity helps you interpret test results accurately and appreciate their role in colon cancer prevention. Remember, no blood test currently replaces the thoroughness of a colonoscopy, but they can be valuable tools in the broader screening process. Always consult with your healthcare provider for personalized advice and follow recommended screening guidelines to stay proactive about your colon health.